baby midwife. I still have a lot to learn and still have a lot to grow.
Are all CNMs APRNs?
Yes. Yep, so we all started out as RNs, and most of us have labor and delivery experience, and then we go back to school, get our masters, and become APRNs. We pass the midwifery boards, and we pass like the I always say I'm like a nurse practitioner that can catch babies. So these are my kiddos.
The nurse practitioner part of you is the prescriptive part.
Kind of.
Or does CNMs have prescriptive authority?
Yes, we have prescriptive authority. We have autonomous practice, that kind of stuff. So, man, I am just so sad. I might have to sit over there and
Well, I put that up,
get my
I think.
notes.
She
Yeah.
says.
Sorry about that.
Tell us about you and I'll get.
Yeah. Okay, so 4 kiddos. This was us this summer. We made a little trip to New York. So my youngest just turned 2 years ago, 2 days ago, sorry. And he's in my little backpack, just me mugging the camera. And then my next youngest is Kaylee. She is 6. And you know what they say about the 3rd kid, she is a fireball. I don't know who else has 3 kids, but the 3rd kid is just, woo, very, she's got a lot to say. And then my next kiddo is Elijah. He is 9. And my oldest is Joy. She is 11. She's in middle school, so we are like learning about preteen emotions, and
I'm so sorry.
every time I say that, people say, "You just wait." So I'm like, okay.
Is that what you need?
Let's see. No, I think maybe.
That's all I've got.
Let's see. I think I can drag. Where did yours go?
Yeah, it's hard to find. You have to find it. Oh, use this one.
Oh, okay. Oh, there it is. Okay, usually notes are down. Let's see. Oh yeah, there they are. Okay, let's see if we can make this a little bit bigger. You guys will be able to just see all of my notes, and that's totally fine. I say I'm from Louisiana, sort of. We moved here, like I said.
Louisiana.
Yes, my husband is true Louisiana. He grew up in South Louisiana. I moved there when I was 15 to North Louisiana, so if you talk to anybody from Louisiana, I'm not true Louisiana. But I can cook gumbo and jambalaya now that I've been married for 14 years to a Cajun. So in my free time, I like to travel. We like to camp. We like to hike. I say we. I like to camp, and my husband likes to make me happy. So. I like to try new restaurants. I'm always looking for new restaurants. I just got into brewing kombucha. I don't know if anybody else does that. It's really fun. I really enjoy it. It's been fun.
Big Mom says that it's more alcohol than regular kombucha has.
Yes. Well, I hear that it's about the same as an overripe banana. So, but thankfully, I'm not pregnant, so I'm drinking a lot of it.
Whatever we find, it's all right.
But I have exploded it onto my ceiling at home. I've got some spots on the ceiling in my kitchen. I don't know if anybody else has done that. But I learned my lesson about exploding kombucha.
Oh no.
My husband came home and I was like, don't look at the ceiling.
And the first thing he does.
Yeah. Oh, okay. And I like good coffee. COVID got me into trying all the coffee things while I was at home, and now I'm a coffee snob. So, and your coffee passes the test. It's delicious.
I didn't make it.
Johnny made it. Yeah.
It's delicious.
It's strong.
Thank you. It's great. It's great.
Actually, that last batch, Rebecca made.
Oh, yes. Okay. Well,
If
anyway.
I followed Sonny's lead, I saw how much you put in there with all the compliments that you got.
She dumped the dump.
Yeah, and anytime during this presentation, you guys feel free to like blurt out things. If you want to add on, if you have questions, if you have comments, feel free to just interrupt me. I I don't mind whatsoever. I appreciate the feedback and I appreciate learning from you guys a lot. So the objectives today, we're going to go over things that can make a pregnancy not low risk anymore. So anemia, gestational diabetes, hypertensive disorders of pregnancy, cholestasis, and thrombocytopenia. We're going to discuss the diagnostic criteria for each of those, and we're going to review some of the management guidelines. So first thing on here is anemia. Hitting the wrong button every time. So World Health Organization estimates that over 40% of pregnancies are complicated by anemia. But it's most frequently due to iron deficiency anemia and also the physiologic changes in pregnancy. So you know, in pregnancy, your plasma volume increases faster than our red blood cell volume increases. So we're going to see that dilutional effect anemia, which is why our cutoffs for anemia are a little bit different than what you see outside of pregnancy. So in the first trimester, we define anemia as less than 11 grams per deciliter. Second trimester, it's a little bit lower at 10.5. Third trimester, it goes back up to 11. And then I just learned this, that we have a cutoff in postpartum that's less than 10. I didn't know that. I thought postpartum, you get closer to back to non-pregnant state. But
When you say cutoff, postpartum, what does that mean to you? What is the cutoff?
so that would be when we say, yes, you are anemic and we need to be actively treating it with iron or anything
Less
like
than
that.
10.
So typically though, you know, that's what I was saying, like I feel like less than 11, I'm going to say, we're going to get you back on because number one, you're still bleeding, you're breastfeeding, we're going to do what we can to keep your breast milk supply and keep you feeling well. So, but yeah, that's what I was saying. I just learned that. 10 is the cutoff. So
And how long postpartum? Like 3 months? Or?
probably 6 weeks.
Yeah.
So risks associated with anemia in pregnancy include infants with iron deficiency anemia at birth, postpartum hemorrhage. So when you're already running low, you're at an increased risk of postpartum hemorrhage, and then preterm birth and low birth weight. I feel like those are two things that any complication you have in pregnancy, you're at high risk of preterm birth and low birth weight. So some symptoms of anemia. Fatigue, obviously headaches. And I know all of this is a lot of review for you guys. So fatigue, headaches, pica. Does anybody have any favorite pica stories? Like what your clients were
I'm trying to think.
craving?
Wanted to eat. I think drywall once. I think I had one. They were remodeling and she was like, that looks really good. I was like,
You're like, you need some iron.
yeah, she knew what she was
Yeah.
looking for. So.
Yeah. We've seen cornstarch, laundry detergent, dishwasher detergent.
Oh, no.
Yeah, it's horrible. But
Oh, couch foam?
oh,
That's a new one. Well, that was my new one.
yeah. Whew, sometimes it's just surprising. So that's just something to watch out for. Obviously, mostly it's ice that we see. Restless leg syndrome. Sometimes you'll have a client who says, "Man, I can't rest at night because my legs." The first thing that we try is magnesium and iron. The two of those help a lot. Hair loss, we don't see that as much in pregnancy just because they're in a different state of hair growth. Shortness of breath and tachycardia are when you get, into that lower hemoglobin. And a lot of times patients will realize later that they were anemic after we treat them. So, we catch it on their CBC or their H&H, and then we treat them, and they're like, oh, I feel so much better. All I wanted to do is eat ice and sleep all the time, and now I feel so much better. So a lot of times we catch it, their symptoms, they realize it after the fact. So, like I said, the main one that we see is iron deficiency anemia. That's the most common pathologic cause of anemia. So we've got dilutional anemia, and then we've got the iron deficiency. So you're going to see on their serum labs that it's a microcytic anemia, which just means MCV, or the mean corpuscular volume, is small. The red blood cells are small. Their ferritin's going to be low, which is their iron count, less than 30. And then you're going to see an elevated total iron binding capacity, or TIBC. That's not necessary to diagnose it, but it's just something that you'll see.
Do you guys send for iron? Do infusions in first trimester when you find that?
Not typically in the first trimester. We start with lifestyle changes, dietary changes, and oral supplements. And
I mean, I'm
then,
talking about whenever you find out, whenever you're very new.
Next.
yeah, we start with PO first off, and then if it's not responsive or they can't tolerate it, we'll get them to iron deficiency. So we do a lot, especially in the third trimester.
Yeah.
Tips on good for ferritin, is that what you're talking about?
Say that again?
Tips to raise ferritin.
Yes, and we will get to that
Okay.
here in just a second.
Okay.
So some contributive factors for iron deficiency anemia, obviously the inadequate dietary iron intake, coupled with increased iron demands of pregnancy. So we're not eating enough iron and our body needs more iron. Short interval pregnancy can also put you at high risk for iron deficiency anemia. Let's see, and then so bariatric surgery, the less common things that we see, bariatric surgery, celiac disease, heavy menstrual bleeding, that kind of stuff.
What about if they're nursing and pregnant? Does that
Right.
make a difference too? Or not so much?
I would say typically not as much, but most of those patients are short interval pregnancies.
Mhm.
So that
Yeah.
kind of falls into that category, but I wouldn't say that nursing so much can contribute, but
Okay.
It's not a short-term situation. This iron deficiency anemia or this iron deficiency alone, this is over time. This is something that needs to be fixed. It needs to be fixed, you need to be looking at it, and this is over time. This is a lifetime that's going on with this woman. So
yeah, a
you
lot of
want
times
to-
you'll see that they have been, like you said, iron deficient for a long time. And a lot of times you'll find maybe their hemoglobin is at a normal level, but their iron level is low. So they're not anemic just yet, but they are iron deficient. And that's the time when you either want to start the dietary measures or the over-the-counter supplement, or both. So, but most of the time, low iron will lead to anemia if it hasn't already.
So do you recommend testing everyone besides just the CBC, doing the iron panel? Or
We don't do that for the first initial visit because most of those patients are not anemic at that point. We do dietary counseling, and so we talk about foods that are high in iron, but we don't run an iron panel first visit. Usually at the 28-week visit, when they're at the highest risk of anemia, we will just do a ferritin. We don't typically do the total iron panel where it's looking at the iron binding capacity, that kind of stuff, because usually it's just the ferritin is enough for us to say your iron level is low. I don't know if you can see this super well, but I thought this was really interesting. I found this on Up to Date. So it talks about your iron requirements during pregnancy, or the patient's iron requirements during pregnancy. So you start kind of down in the left-hand corner. You've got menstruation, so your iron requirement comes up. I'm going to come over here and kind of point a little bit. And this red band is the normal turnover that we need. So we always need 1 milligram a day of iron. And as pregnancy progresses, the maternal red blood cells require more. And then starting around the 7th week, we need even more due to the fetus in the placenta. So by the time you get all the way around to 40 weeks, you need 7 milligrams a day of iron. So I thought this was really interesting. I like a good picture that kind of gives me an overview of what to expect.
Do we get these slides?
I emailed them to Deb, but
Email or?
Yeah, it's
Yeah.
just like.
I don't know if it's causation correlation, but I've seen it for years, even in myself. Thyroid disorders and anemia tend to run parallel.
yes,
Causation
thyroid
correlation. So
and
if you've got someone that's got thyroid, please be checking their hemoglobin and
yeah, and their lupus status. I found a lot of thyroid, a lot of patients with thyroid issues have a lot of glucose issues as well.
first, yes,
Attest to that?
yes,
All three.
third person, yeah.
So your ferritin plays into and supplies
Yes.
over 150 functions in your body.
Yep.
And if your ferritin is low over time, then the repercussions are the thyroid issues. So you don't look at thyroid if you're having thyroid issues. You really, the base root cause of most items that are going on with postpartum women are gonna be the ferritin. So that's like where you start. And then it starts to heal your thyroid, most likely if you're not that bad off. But you have to heal the ferritin, which is the storage, first.
Can anybody then explain why the medical community doesn't even check ferritin? I can get insurance companies to cover labs, but they don't cover ferritin. They always single it out. They don't consider it part of anything as far as monitoring the ferritin.
Right, because you don't have cancer.
Ferritin,
Yeah, you
yeah,
have
so you have to order it
Yeah.
separately.
Ferritin's extra.
Yeah.
Why doesn't
It's
insurance
just-
cover midwifery?
It's just such
Right,
an,
yeah.
well, I know, but it's just such an important part. It's like,
It is.
the doctors are not even looking at it. That's just frustrating.
It is,
Yeah.
but you can look at it.
Oh, I do. Yeah, I do. We order it and I'm like, you're gonna have to pay for this one out of pocket or whatever, you know. But, if if I'm ever in any kind of a consultation with a doctor over somebody who we're dealing with anemia or whatever, they're like, they don't even, it's just out of their mind, the whole ferritin thing, you bring it up and they're like, oh, I don't know, we don't check that.
Yeah, I think typically, we're looking for that anemia side of things, and so we're kind of late to the show. So we could be iron deficient and we're not treating it, just like you're saying.
Right.
So that's where that dietary counseling really comes into play, because that's the best absorbed iron anyways, it's gonna be in your diet, so, yeah. So, I know we did go over this, so anytime we find either, low iron or anemia, we're gonna start with oral replacement. So we're gonna talk about dietary changes. What are your favorite things to tell your clients in their diet? Yep, that's a good one.
I have an 8-page protocol for this.
Do you?
So if
You
there's
can
not one,
teach
there's
it.
not one favorite thing.
Yeah, have you, so my favorite book, have you read Lily Nichols?
Real
Yes.
food for
She's
pregnancy.
one of my favorite, yes, her book is so dense. It's like, oh, I can read a few pages, but
What's it called?
Real
For
food
gestational diabetes and real food for pregnancy.
yeah. Yeah. So we talk about, liver is gonna be the powerhouse. You're gonna, if you like liver, I find maybe 1 in 50 of my clients like liver.
They can do the pills if they don't like
Yes.
to eat it.
Yep.
And I see it,
They can do pills.
Well, so do you have people taking beef liver?
I have a few. Mm-hmm.
Have you calculated how much iron you're getting from
No,
that?
I haven't.
You wanna know a little bit about that?
Yeah, tell me.
You wanna know about this fad with the liver and
Yeah, let's hear it.
organ pills?
Oh, yeah.
Calculate it. 3,000 milligrams of any organs or liver,
Uh-huh.
is 3 milligrams of iron.
Alright.
6 pills to 9 pills in most of those bottles, or what you have to take daily
Yeah.
to get that 3 milligrams of iron. You're not gonna absorb it all.
So really, they should just be taking a regular iron supplement.
Something that's not gonna bother their digestive system,
Yeah,
yeah,
that's
because it has
tough.
higher amount.
Yeah.
Yeah.
So when they take it and they're like, I don't know why it's not going up, it's because you're following the Liver King's
Uh-huh.
fad.
Yeah.
Yeah.
It's a good supplement, it's just not gonna help you if
It's
you're
not
drinking.
enough.
Unless you're taking 10 at a time.
I usually
Well,
give them
if
a
you're
long
efficient,
list
it's
and
not
say
gonna
do
do
about
anything.
5 a
Take
day.
it anyway, but it won't help you.
I've wondered, I thought, I've never had that liver supplement work.
It's because it's
I don't
so
even
low.
recommend it, but people don't take that. I'm like,
Gestational
well,
diabetes.
Yeah.
And they're
Yeah.
both really comprehensive reasons.
So we're cooking in a cast iron
The one-
pan, we're
those
telling
are-
them to
that's
eat
not bad.
liver,
They're real easy.
red meat. You hear a lot about green leafy vegetables, but we don't absorb that iron as well. They can do it, but it's not gonna absorb as well. So I say, you gotta eat your meat, that kind of stuff. If you're not eating meat, you need a really good supplement.
Well, something to know about the greens.
It's a good one.
What was it? A blackstrap. Something to know about the
Beans,
greens.
seeds, potatoes, there's mushrooms.
Dried apricots are one of your highest non-meat,
Okay.
like fruit veggie ones.
Now keep going.
High vitamin C to help absorb it.
Yes.
Yeah, vitamin C and
Dried
vitamin
apricots.
B12 if you're not eating meat.
Yes.
vitamin C.
And you can have calcium at the same time.
And with the
Right, so if they're popping tums,
So cooking the greens makes them more absorbable.
Good to
I
know.
discovered that when
Maybe
I
cooking
was
with
in
cast iron pan.
Yeah, when I was anemic after a miscarriage years ago, and this is when I wasn't a midwife and I didn't know anything, and I thought I was dying because I was like, I couldn't stand up.
Yeah.
I was down to 6 in my hemoglobin.
Wow.
But I had been eating raw all summer. I was on that raw food fad,
Yeah.
and I was literally eating
fast.
like, I was eating like collards cut up into ribbons for salad. So and what I made tasted good. I made it
Yeah.
taste good, but it was not enough. And I was like bleeding all summer, just little bits all summer, because I was anemic. And I was reading up on it, trying to learn about it, and I needed to cook them. So, but red meat's what got me back on track.
Yeah.
And I think blood type makes a huge difference with that. If you're type O, most type Os need the meat. Type A's can often get by and thrive on the vegetables, bringing it up. So it
You
just
have to
kind
be
of
really
things.
intentional whenever you're not eating meat, because you
Mhm.
have to have your iron before 11 o'clock in the morning. You have to not have calcium. You
Right.
have to have your B12 along with your iron,
Yeah.
and you have to have your vitamin C. So you really have to be intentional, and then you have to eat iron on every plate that you eat off of
Yeah.
that one.
Yeah.
Does anyone ever recommend Hemoplex?
Yes.
Always,
Yeah.
that's my go-to.
Fairs or.
Is
And
one
another
better
thing,
than
they
the
need
other?
to move.
You don't think so?
That's it right there.
It's like your Floordex.
You gotta get up and go.
Huh?
Floradex is liquids and
Right.
Hemoplex, you know, those huge pills.
Well, Floradex is 10 milligrams for your dose, and Hemoplex is 85.
Yeah.
Hemoplex also has your B12 and your vitamin C.
Right.
but
I would,
Floradex
that's
does too.
that's my first recommendation.
Yeah, Floradex
So
didn't
Floradex,
bring me
you
up
have to
when
say
I was
take 8
anemic.
times
That's
the
what
dose. So you just have to make sure and tell people that.
So Hemoplex is on the
And Floradex
Yes.
is a lot more expensive.
And the best Floradex is the slow release in the box,
Yeah.
not the bottle. The slow release Hemoplex in the box is the two. And I say this from first person experience and from client experience.
Yeah.
Has anyone ever heard of the iron fish before?
Oh, I have your client.
Oh, I missed it, sorry.
Is it FISA?
Yeah, it's literally
It's
an
a
iron fish.
Fish, you drop it in all your stuff.
I know, yeah.
Yeah.
And they're easily accessible. You can get them on Amazon or I think Walmart. That's a good idea. It's a cute little stocking
What is
stuffer.
it?
It's just an iron fish. And you put it in whatever sauces or soups or whatever you're cooking, and it adds iron to your food. So that's when it works really well. Yeah. Yeah. Yeah, I know. Yeah. I love that idea. Just taking care of your iron requirements and your stocking.
right.
So fun. I love a good stocking stuffer.
Ooh, so just in case anyone doesn't know, or if you don't know, do you ever tell people to take 3 arrows?
I've heard of it, and some of the other midwives have been talking about it. I haven't looked into it.
Vegetarians don't notice it.
Okay.
But it is a really good one. It's highly absorbable. So compared to if someone doesn't like a Hemoplex or
Yeah.
doesn't like a Floradex, 3 arrows is a
3 arrows.
3 arrows?
3 arrows. Okay.
Yeah.
It's just, is it 3 arrows iron supplement? or-
I like
brand
iron. It is, I like Iron Plus, I think is what it's called. So there's
I've seen
at
that
least
one
2
too.
of them. And the Iron Plus just has I think it has B12 and vitamin C.
Mhm.
It worked better for me. I am the picture of IDA.
Yeah.
So you
And I
studied
developed this
you
for a
got
friend and as well as
Yeah.
myself, and I have 98% of my clients who are IDA. So if you start testing everybody's ferritin, whenever you do your CBC first trimester, you might find that 98% of your
Yeah.
population
Check
or more
the first
have
one.
this going on. And we might have better outcomes if we get people robust by fixing this from the start. And that's what I'm fighting. So I'm here to like boost you up.
Yeah.
Show your protocol.
I'm also IDA, and so is Christina. We all take something different. Hemoplex works for her. It doesn't work for my digestive system. But I take this one. It's a tincture,
Yeah.
and it's the only one that I have found that won't stop me up, that I can absorb really well, and it actually changes my iron.
And what's it called? What is it?
It's iron drops, and they're in a tincture form. It's from a company called D-Lib, D-I-L-I-B, and it's in this little red box. I have to order it online. But it's the only thing I have found that absorbed and started to actually bring my iron levels up.
So just throwing out there, I'll talk to you guys later. You probably need digestive enzymes then.
Oh, I take
And
those
if
too. I take those too.
ferritin is low,
Yes, it
you
is.
will always be anemic. So you
Yes.
have to raise the ferritin first.
Well, I mean, I do all the things. I do the B12 shots and I do all the vitamins in them. I'm doing all the things.
Yeah. that's from Rachel.
She doesn't.
Is it Shovable?
But yes, right.
Farmerville. Do you ever recommend Farrow food
Fair.
from Standard?
No, I recommend getting the ferritin up with the iron infusion step.
Okay.
And once you got that up, you can work on everything else.
Okay.
Because you can't fix anything else. You're just gonna
Right.
stay.
You're gonna spend a second talking
So we're gonna, so like we said, we're gonna talk about those dietary changes. We're gonna recommend an iron supplement as well. And then we're gonna plan to recheck your CBC and ferritin in 4 to 6 weeks. You should expect at least 1 point increase in their hemoglobin, hopefully more than that. If it's not, we need to move on to an iron infusion. We have recently started those at UAMS. And I say recently, but in the past couple of years.
Is insurance covered?
Insurance is covering it.
Are you guys using benefits?
For some, some of them we do for Medicaid. Medicaid covers a certain one. And then we do a different one for Blue Cross Blue Shield. We shoot for the shortest amount of infusions. And I think the private insurance covers the ones that are like weekly for however long, but Medicaid covers the 2. And I'd have to look back and see. I know Minifer is one of the options, but I don't remember if that
Or
just
just
covers.
Cigars anywhere?
Yes. Yeah.
Is that what y'all use for the other insurance or is it a different?
I have to, I know we use,